Good afternoon and welcome to this live telephone town hall. Welcome to this live telephone town hall. We are dialing out to thousands of homes in the Flint area. On this telephone town hall, we're going to be answering your questions live, and we're going to be giving you a chance to participate in interactive survey questions. Most importantly, we will be discussing the COVID-19 pandemic and the economic assistance that is available. Our speakers will be joining us in just a moment, including Governor Gretchen Whitmer, so please stand by. As we get more folks on the line, I just want to tell you how you can participate in today's telephone town hall. You can simply press 0 whenever you have a question. Press 0 if you have a question. You will be placed in a queue, and our operators will then assist you in answering your question. Our speakers are going to answer as many questions as they possibly can in our time allotted. If you do have a question but you don't want to go live, you can just let your operator know and we can read the question for you, whatever's most comfortable for you. We've just had some new friends and neighbors join, so I want to welcome them to the call and let you all know that our speakers will be here in just a moment, including Governor Gretchen Whitmer, so please stand by for just one more minute as we get more callers on the line. We're going to be discussing the COVID-19 pandemic and economic assistance that's available, so this is an important call. We encourage you to stay on. And if you have a question and would like to participate by asking a question live on the call, please press 0 at any time. Press 0 on your keypad, and you will be sent to a queue where an operator will assist you in asking your question. Our speakers are going to get to a lot of questions, and we'll answer as many as possible tonight in the time that they have. Finally, if you do have a question but you don't want to go live on the air, you can just let your operator know, and we can read the question for you, whatever's most comfortable for you. With that, I'd like to turn the call over to the Michigan State Director for the State Innovation Exchange, Tom Lennard, the Michigan Director. Go ahead, Tom.
About work being done to protect our community's health, our economy, and our democracy during the COVID-19 crisis. My name is Tom Lennard, and I'm the Michigan Director for the State Innovation Exchange. And I'd like to introduce our state lawmaker panelists, and then have Governor Gretchen Whitmer give us an update. Then we'll have the moderator get right to your questions. But we also have Dr. Lawrence Reynolds, pediatrician and health advisor to Mayor Neely, Kirk Smith, president and CEO of the Greater Flint Health Coalition, and Steve Gray, the director for the Michigan Unemployment Insurance Agency. They'll all be available to answer your questions. So first, we're going to go ahead and get started with a few words from Senator Jim Ananich.
Thank you very much, Tom, and thank you everyone for being on today. It's really important that we get the opportunity to have this. I'm Jim Ananich, and I live in Flint, but I represent about 60% of Genesee County, from Swartz Creek to Flint Township, Burton, Mount Morris City and Mount Morris Township, Genesee Township, Richfield Township, Forest Township, Thetford Township, the City of Clio, and Vienna Township. So I'm really glad to have folks from all over our area on to talk and to listen to what we have to say and ask some questions. Thanks a lot.
Thank you. We're really glad to have you. And now we'd like to hear a few remarks from State Representative John Cherry.
Thank you, Tom, and thank you, Senator Ananich. I'm State Representative John Cherry. I represent a portion of the City of Flint, Flint Township, Swartz Creek, Flushing, and Mount Morris City and Township, and I'm really glad that everybody's been able to join us, and very grateful to our panelists and the governor for helping answer questions for folks around Genesee County.
Thank you. And now we'll hear a few words of an update from our Governor Gretchen Whitmer.
Well, hello. Thanks so much for making time to be on this call. It's really important that in this global pandemic that we stay close to one another. We avail ourselves of every opportunity to get information. I wanted to be here to field some questions to make sure that I'm staying focused on the things that I know you care about. You know, COVID-19 is a novel virus, and that means, you know, there's no vaccine and there's no cure. This is a highly contagious virus that you can carry for days without even knowing it, and it can be deadly. We know that the way, that I react to the virus could be very different from how my husband reacts to the virus. We just don't know how our body's going to react, and that's why it's so important that as we have none of these tools, the most important one that we have is to stay away from one another so the virus can't spread from person to person. We know that the stay-home order, it's been a few weeks now. It's been hard. We're asking people to make a real sacrifice by not going to work or closing your business or staying home during the holiday and missing time with your loved ones. And I know it takes a toll, but the fact of the matter is this is the most important tool we have to save our healthcare facilities, to save lives, to save our economy from longer-term flux. And so that's why I've extended the stay-home order. We are seeing that this order is having some good impact. There's some little bright spots, not enough to conclude that it's worked, but there's reason to believe that it is working. And come April 30th, we can really start thinking about how do we safely re-engage sectors of our economy in phases and get back to living life the way that we're accustomed to. It's not going to be like flipping a switch. It won't happen overnight, and life might not look like it did in February for a while. But if everyone keeps doing their part, if we slow the spread of COVID-19 and do it for our loved ones and for our nurses and doctors and grocery store workers and people on the front line, we're going to get through this together. We're going to get through it in a way that our economy, we can rebuild it, and we will save lives, which is the most important thing that we're centering all our work around right now. So thanks so much for making time. Thank you for doing your part. I'm looking forward to answering some of your questions.
Thank you very much, Governor. Folks, if you've joined us in the last few minutes, then please press 0 on your keypad if you have a question for anyone on our panel here today. Please press 0 if you have a question, and we can take it live. We'll take our first question. This is for you, Governor Whitmer. This is Larry. Larry, can you please tell us where you're calling from, and what is your question, please?
Hi, I'm calling from Flint, Michigan, and I'm really concerned about Trump opening up the country too soon. What can you do to stop this crazy person?
Well, Larry, thank you for your question. I appreciate it and the spirit of it as well. I'll just say this, the country is not going to reopen via Twitter. What has happened is there hasn't been a national strategy, and then so it's been on the shoulders of governors like me, governors like Andrew Cuomo, who you probably see on the television a lot in New York, governors like Mike DeWine, Republican, who is the governor of Ohio, to take the action that hasn't happened at the national level. Because of this, I think we've saved a lot of lives. But the fact of the matter is, each of us is determined, I believe, to make the decision about re-engaging our economy driven not by someone's tweet in Washington, D.C., but by what is in the best interest of the public health of our states. And we have the power to do that. And I can tell you this, I am mindful of the hardship that's been imposed on people. I know what this has done to our economy. But at the end of the day, I've got to listen to medical experts to know when and how it's safe to re-engage our economy, and that's precisely what I'm going to do.
Thank you. Up next, we have Carolyn in Flint. Carolyn, please go. Actually, this is just a comment from Carolyn that she asked to be read for you, Governor. And her comment is she just wants people to know that she appreciates the job that you are doing for the state, and she wants you to stand your ground and do what's right for the people.
Well, that is so kind. Thank you. I know that a lot of people are really stressed right now, and they're lashing out a bit, and I understand that stress. People are grieving the loss of their freedom, or the loss of their job, or the loss of their loved one in the worst scenarios. The fact of the matter is, we got to do what is the right thing to do at every turn. And so thank you for supporting me. I appreciate it. And I hope that you are staying home and staying safe too.
Thank you very much, Governor. Folks, a reminder to please press 0 on your keypad if you have a question. Press 0. We're happy to take your question live, or we can read it for you. Now we're going to hear from Senator Jim Ananich, who will remind us of some of the work being done to help workers and family during this time. Senator.
Thank you, Ivan, and thank you very much, Governor. And I really appreciate you joining us and taking some questions and giving us some important information. As the Governor mentioned, these are hard times, and we all know that. And we're looking for strong leadership, and I think we've seen that in Governor Whitmer. She's doing everything she can to keep us safe, both our loved ones and family members throughout the state, but also the frontline workers that, whether they work in a hospital or they're, make sure we have food, or all the different folks that are sacrificing. I think one of the things that's really important is that we all are essential in this fight. Whether we're working in a hospital as a nurse or a doctor or an orderly or one of the other really important jobs, or making sure people have food, or they're a truck driver, or we're the folks that just stay home and stay in place because we're making sure that we're not exposing other people. As the Governor mentioned, so many folks may have the COVID disease, but they show no symptoms, and you have no idea you have it. You could pass it on to somebody else. We've seen example after example across the country where one meeting is the pinpoint for where 100 people got sick, or maybe a handful of people got sick and took it all over the country, all over the state. So we all have to do our part, and we have to sacrifice. And hopefully, that, as the Governor mentioned, that work will be paying off, and then we can actually open back up at the appropriate time in a safe way to make sure that this doesn't pop up again and again and again. So really, I want to make sure I thank everyone who's on the line for doing their part. Some of the things that I think we're going to talk about, and we have the director of the Unemployment Agency on here, and a number of health professionals, are some of the unemployment work that we've been doing and the Governor's been doing. Michigan took a very dramatic step. They were the first state in the country. I voted against this, but they were the first state in the country to go from 26 weeks of eligibility for unemployment. They took it back to 20. Because of the emergency, we've been able to extend that back up again. We've been able to help folks in all sorts of sectors, whether they're the traditional worker or the gig economy or self-employed. So we're going to see a number of those things happening where the director will talk about some of the ways that they've added some more individuals on to help take the large amount of calls. We've gotten an unprecedented amount of people unemployed right now because of this COVID-19. And I think we're going to continue to work hard to make sure we get everyone as much help as we can get them, because there's a number of people that they've worked their whole life to start this small business. They work hard every day, and they're now forced to have to close their doors, hopefully temporary. The Small Business Administration Disaster Loan Assistance Program is another program that will be available for a number of folks throughout the state, throughout our community. And I think one of the things that we'll talk about some of the details as we answer questions. But I think one of the things that we have to make sure we do is that we, even though we're not allowed to physically see people, we need to make sure that we connect with people. All of us can get isolated. We can all feel stressed, and sometimes the reaction is anger. It's lashing out. And I think what we need to be doing is holding each other tight and looking out for people and finding out, is there somebody that needs something, and can you do it in a safe way? Can you deliver them food or something in a safe way? I think we can all do our part to make sure we help people. So again, thank you very much, and we can talk about some more of the details as we get more into the call and ask questions, and I'll kick it back off to you to hand it over to Representative Cherry.
Go ahead, please, Representative John Cherry.
Thank you very much, Senator Ananich, and I just want to echo some of Senator Ananich's thoughts in thanking everybody who's come out and the Governor for answering some questions and giving information to folks. It's been a very tough time for our communities and friends and neighbors, and so I want to say a big thank you to all those folks who've been helping out in their communities, whether that's folks in my neighborhood or yours who've been sewing masks for folks, or the folks putting themselves on the line every day, healthcare workers, grocery store workers, first responders. And one of the items that has really come up frequently when folks contact our office is unemployment. So want to make sure that folks understand that the benefits, unemployment benefits previously have been 20 weeks, and those have now been, under Governor Whitmer's order, extended to 26 weeks, and then through the CARES Act, extended again to 39 weeks, so that there's a cushion there for folks who've been laid off during these hard times. And they're expanded to folks who are not typically eligible or who are not previously eligible for unemployment. So folks who are self-employed or low-wage workers, folks who file 1099s, we call independent contractors, and that just started this week. So those folks can now apply for unemployment benefits, and those benefits themselves have been enhanced by an additional $600 per week, so to make sure that folks are going to be able to afford the basics as if they're not working right now. And then there's been some information out there where we've had issues processing because the overwhelming volume of filings that have occurred. About a quarter of Michigan's workforce, I believe, is filed for unemployment benefits, and it's unlike anything we've ever faced, even during the Great Recession. And so new staff have been brought online, and they're bringing new servers online to help respond to those. So I know Unemployment Insurance Agency is very grateful for everybody's patience on this, but please continue to apply under the new requirements that are out there. And I just want to put a little bit out there is beyond information on stuff that's been responded to already. One of the things that this crisis has highlighted for me, and I think many other folks, is just how many people in Michigan have not had access to paid sick leave through their job. 1.5 million Michiganders don't have access to paid sick leave, and that's something we need to make sure that we change in the state today and for tomorrow, so that when people get sick, they're able to stay home and care for themselves, and then also not contribute to and not have to worry about losing a paycheck to protect everybody else at their job from being sick. So those are a couple of items I just wanted to highlight, and I know the governor's gone to great lengths to make sure folks have those expanded unemployment benefits and making sure that people have economic assistance as they've been affected through this crisis.
Thank you. We'll take our next question. This is Nancy, and Nancy, this is a question that we will direct to Kirk Smith, who's on the line. He's the president and CEO of the Greater Flint Health Coalition. Nancy, please tell us where you're calling from and what's your question, please.
Hi, I am from Fenton, Michigan, and first I would like to thank Governor Whitmer, too, for her leadership and her grace and dignity in a very difficult job, as well as all of you. My question is this: why are face masks not mandatory when out in public?
Hi, Nancy. This is Kirk Smith from the Greater Flint Health Coalition. It's a great question, and one that certainly we're talking a lot about. Really want to recommend first and foremost the idea of practicing the precautionary principle, which really is if we're in a place where we have to move away from home to go out into places where community-based transmission or close quarters may not be possible to keep those strong social distancing degrees amongst one another, like grocery stores, pharmacies. Those are ideal times that everyone should wear those cloth face coverings. I think one of the reasons that they're not mandatory is everyone necessarily doesn't have them. But we really do strongly encourage that individuals who have to go out into those public settings for those essential services do practice those precautions and wear those. There's some great resources online at the Genesee County Health Department website, gchd.us. You can click on a link to the CDC that can give you information on how to make one at home. And the last thing I would add is to encourage everyone is if you do have the N95 medical grade masks, we don't encourage you to wear those in public. The cloth masks are adequate. We encourage you to donate those to our first responders and our medical professionals like those at Hurley Medical Center.
Thank you very much. Our next question is for Dr. Lawrence Reynolds, who is the health advisor for Mayor Neely. And this question comes from Aletha. Aletha, can you tell us where you're calling from and what your question is, please?
Hello?
Aletha? Hi, Aletha.
Yes.
Go ahead with your question.
Okay. With all this coming on, we know that we're supposed to stay safe. And I'm just confused because here we have people dying, like some of my friends who we are all retirees. You stay in self-quarantine. And then I have two friends that end up dying this past week. So if you stay home and supposedly are self-quarantine, what are you doing? The old-fashioned remedies where you put a pot of water on the stove and put lemons and stuff in and breathe out? I mean, what are the precautions besides staying away and covering up?
That's a good question, Aletha, and we should be clear. Number one, wash your hands frequently. Clean the surfaces that you eat off of. Don't share eating utensils, plates, or food. And then you should have in your household some Tylenol, something for fever, and a thermometer so that if you feel warm, you can check your temperature and start your Tylenol and give your doctor a call. You're having a clinic or a doctor that you can talk to is most important at this time because he or she can give you instructions on what to do next. The other important thing is do not smoke, do not vape, and don't allow people who do that in your house because smoke damages lungs. And so you don't want to damage yourself or others around you. And most importantly is check your insurance card. Make sure you know who your doctor is and you have that telephone number to call her or him if you have any questions.
Thank you.
Thank you.
We will turn the call now over to Steve Gray, who's the director of the Unemployment Insurance Agency. Steve, do you have any tips for us or any thoughts for us, please?
Thank you. I appreciate Senator Ananich and Representative Terry giving me the opportunity to come home to some extent, even though it's virtually. I grew up on the east side and graduated from Kersley High School. And I appreciate the opportunity to talk to people that are filing claims. And I just want to make sure that everybody understands that we're committed to make sure that every eligible worker in Michigan who applies for unemployment receives them. We've, obviously seen historic levels of need and claims. So we're now over 1 million claims that have been filed since March 15th. Obviously, we aren't alone to see these large increases across the country, but maybe surprisingly, we're the third highest state in the country, just behind California and Pennsylvania. We're higher than any of the other Great Lakes states and even New York in the number of claims that have been filed. We've expanded our web servers even prior to these claims coming in. We've added staff, but every state, and including us, have struggled to some extent to keep up with this. Although the fact that we've been able to take over 1 million claims since March 15th, lets us know that the system is working. But most people that are eligible, 90+% of the people that are eligible have been able to file. We've also paid out over $350 million, just in the last 3 weeks alone to over 600,000 Michiganders. So the claims are coming in and the money's going out, but we understand that and we recognize that that's little comfort to the thousands who are worried about their economic future and they need additional help to complete their claims. So that's why we're working around the clock and we won't rest until everyone is helped. It's important to remember that claims are backdated so that it reflects the date that you were laid off due to COVID-19, regardless of how much time has passed. So when you get your claim filed and you get your weekly certifications in, then you'll get back pay to make sure that you're covered. About 90% of the claims are filed online. and that's what we're encouraging everybody to do. It's much quicker and much faster, saves time for everyone if you go to michigan.gov/UIA to file your claim. So I will say that yesterday, Monday, for about 6 hours, the website was struggling because we just had an unprecedented number of people that came in to file their claims early in the morning. But we know that other states, other systems in the state were also impacted by that. The Department of Health and Human Services was one of them. The state's IT department, DTMB, has assured us that they're adding additional server capacity, and they've done that. And everything seems to be working. So after 3 p.m. yesterday, we saw higher traffic than at any point in the last few weeks, and the server and the website was able to handle the traffic and help more people file their claims and receive the benefits. The other thing that we're asking people to do, and this is important, just to keep the demand on the servers at a more regulated pace, is to file your claims by last name. So if your last name begins with A through L, you should do it on Monday, Wednesday, or Friday. If it's M through Z, it's Sunday, Tuesday, or Thursday. And then if you're unable to get in or aren't able to file on one of those days, then Saturday is the time to do it. We're asking you to file during off-peak hours. So that means starting after 8 p.m. And if you've already filed your claim and certified, we ask that you not try to log back into the system, just to make it easier for your fellow Michiganders who haven't been able to do that, So that's some of the tips that I've got, but I'll be happy to answer any questions that come up.
Thank you very much. Our next question is for Senator Jim Ananich. This is Kim. Kim, can you please tell us where you're calling from, and what is your question, please?
Hi, my name is Kim Nagy. I am chair of the Ottawa County Democratic Party. So I really appreciate being on this call, since all of our representation in Ottawa is Republican. I appreciate all the work that you're doing, Senator Ananich, and that you gave me the opportunity. My question is, are we going to coordinate our responses in terms of a state coalition, such as the coalition that they have in the Northeast and out on the West Coast between Michigan, Ohio, Indiana, et cetera, so that we're not doing a one state at a time? Has there been discussion around that?
Thank you very much. That's a very good question, and thanks for being on. Aside from being a senator, I'm also the minority leader. So there's the term that we use in Lansing and around the state is called the quadrant. So it's the minority leader of the House and Senate, the Speaker of the House, and the majority leader and the governor. So we're having regular conversations, using social media, texting, emailing, things like that as well. And actually, I brought that exact question up to the governor about, we saw it in the Northeast with the 6 or 7 states over there, and then the Northwest with Oregon, California, and others are looking at coming online together. And so far, we've seen great working relationships between our governor, the Republican governor in Ohio and Indiana, and the Democratic governor in Illinois. So I think a lot of those conversations are happening and looking at best practices and how our states are very similar in some ways and how our states are different, what plans are in the works. There's also a bipartisan work group going on in the Senate, 3 Republicans and 3 Democrats, looking at talking to folks in all different industries, but of course highlighting the important work and information from the medical community. So I think all those conversations are going on right now, and trying to figure out, get the best advice we can to make sure that we look at sectors and the timing, but the primary goal will be to make sure we keep everyone safe, so that when we do open up, it can open up for the long term. Because I think what we've seen in other countries that have tried to open up too quickly is they open up and they have a surge again and they have to shut down again. And I think anybody who's thinking about this logically would recognize that opening up and shutting down is no way to run an economy. So we have to do the important work we're doing now, which is staying home and staying away from other individuals, which is difficult, of course, so that we can open up and open up strong. So thank you for the question. And I wanted to take a second too to mention to Alethea, as was mentioned, I live here in Flint too, as does my colleague John Cherry. And I just wanted to tell you I'm sorry for your loss. I know a lot of us, especially in the last week or so, have started to hit really, I mean, the numbers across the country and across the world have been, very high numbers of people are dying. But when you have someone you know, it obviously hits home even more so. So I want to tell you I'm sorry about that. And hopefully we'll all keep continuing to check in on folks and make sure that they're safe. Thank you.
Thank you very much, Senator Jim Ananich. Folks, we're going to do our first live survey question. We'd like you to vote on your telephone keypad. I'm going to read the question and then read some answers, and you can respond with which answer you agree with. The question is, what is your biggest concern right now? Press 1 if it's personal or family history. Press 2 if it's access to food. Press 3 if it's paid sick leave or job loss. Press 4 if it's utility shutoffs or eviction. And press 5 if it's losing my small business. Again, the question is, what is your biggest concern right now? Personal or family safety? Press 1. Press 2 for access to food. Press 3 for paid sick leave or job loss. Press 4 for utility shutoffs or eviction. And press 5 for small business. Go ahead and continue to vote, and we will take our next question. This is for Representative John Cherry. This is Steve. Steve, can you please tell us where you're calling from, and then go ahead with your question.
Yes, I'm from Burton, and my question pertains to the upcoming election. And I'm aware of candidates out there that have been unable to circulate petitions to gather signatures to get their names on ballots due to the executive order to stay in place. And I was wondering if any provisions were being made for those candidates to get on the ballot.
Well, thank you, Steve. This is John Cherry. And in terms of folks who are trying to get on the ballot, when it comes to U.S. House candidates, they have to collect signatures. And there's currently a lawsuit on that a candidate for U.S. House has filed, I believe, in federal court, and that's going through the court process right now, and he's seeking relief and a postponement of the deadline. Now, what was recently in the news was that there was a settlement offer to postpone it till I believe late May, and that was rejected. So I don't know what the status will end up being on that particular lawsuit, as there's about a week left. For other candidates, though, I mean, they can file paying a filing fee, and they can send that into their clerk if they're wishing to file. So right now that's being handled through the courts, and there are no executive orders concerning those candidate deadlines.
Thank you very much, Representative John Cherry. Folks, if you have a question, you can press 0. Press 0 on your keypad if you have a question. We will answer as many as we can. We appreciate all the good questions that are coming in. Next up, we're going to take Elise. Elise, this question is going to Kirk Smith for the Greater Flint Health Coalition. Elise, please tell us where you're calling from and go ahead with your question.
All right. I'm from Flint, and I had a question about the virus itself. I wanted to know, I thought that I might have had this virus back in February, around the 13th, 12th or 13th. I went to the hospital, and they swabbed me for a flu and did some testing on my lungs and that, but I had a very high temperature. And this was different. I've had the flu before. This was way different than the flu. But anyway, I was told to go home, and I had medication. My thing is now, if I had this virus, and I've been covering up when I go out, I've been doing that. I've been staying in, I want to know, if you've had the virus, can you keep spreading it? Or can it be spreaded if I go out amongst people? Or how would I know I guess this is my question is, how would I know if I had that virus?
Hi, Elise. This is Kirk Smith from Greater Flint Health Coalition. This is a great question, and it's one that we're talking a lot about. With with coronavirus, this is a novel virus, and what that means is we don't know everything about it yet. And that's not just locally, but it's across the world. One of the things that has just started in Michigan within the past couple of days is the largest study in the entire nation to learn more about those who've had COVID-19 before and whether the antibodies from having it offer protection once an individual or someone who has had it before has been infected and they recover. So can they continue to spread it? Could they potentially get it again? Just as a novel virus, we don't have that information yet as a country, but that work is now underway. With that said, if you don't have active symptoms, the recommendation is to do exactly what you just said. Follow the stay-at-home order. If you have to go out, wear a face covering, a cloth face covering, practice social distancing. If you do those types of things, you not only protect yourself, but you also protect the spread to others.
Very good. Thank you. Senator Ananich, this question is for you. This comes from Ashley. Ashley, can you tell us where you're calling from and what your question is, please?
Hi, Senator. Yes, this is Ashley Davenport. I'm with the Michigan Ag Today Radio Network, and I'm based in Kalamazoo. And as the minority vice chair of the Michigan Ag Committee, and Governor Whitmer, if you would like to say something, please feel free to jump in too. But there's a lot of focus on national aid for farmers. What state resources are available for Michigan farmers during this time, or are there any?
Thank you very much, and it's a good question. And obviously, if you'd like a little more in-depth, longer discussion, we can do that as well afterwards or at a different time. So I will mention the federal, just because I think it's important to mention it. But I know you want specifically to state, but the USDA.gov/coronavirus is where a lot of the federal resources are coming in. And then I went to the Michigan.gov/coronavirus resources, particular for farming. Obviously, as you know, and folks around the state that are most likely aware that we have extremely diverse ag in our state. I mean, compared to other states, we have the most diverse agricultural systems in the whole country. It's the second largest part of our economy, so it's extremely important. So a number of the programs, whether it's small business or some of the other programs that we currently have, whether it's unemployment assistance and other things like that, will still be available, and we can make sure we get direct what exactly those resources are for specific farmers. We have a lot of berry farmers in parts of the state. We have a very robust sugar beet farming in the sort of the Thumb and the Bay Area. So we will work to make sure that any person who is struggling to get resources or assistance, whether it's through federal or through the state, we can help to make sure that we address those issues. In large part, the large amounts of money that are coming in, the $2 trillion stimulus package was passed by the federal government. That's coming to our states now. We'll be figuring out the exact dollar amounts in the coming days and weeks, and then so many more of those programs will be available. So what we're trying to do is make sure that we get everyone the assistance that's currently available, and then we'll assess the problems and areas where we need to make improvements, and we will then also address those. So the farming community is extremely important to us here in Michigan, and we will make sure we continue to work with them and their associations to help make sure that we're meeting their needs. So it's an extremely important question, and it's something that I will continue to push on as well. Thank you.
Very good. Representative Cherry, John Cherry, this question is for you. Katie, please tell us where you're calling from and what is your question?
Hi, this is Katie. I am calling from Flint. My family owns a semi-truck dealership called CNS Motors, and we are just looking for some opportunities to help distribute all these wonderful PPE and supply stuff that people are making, and we're just trying to find an opportunity to help out.
Well, this is John Cherry, and Katie, I just want to say thank you very much for offering to utilize the resources that you have and to help others in this time. That's very much appreciated. anybody who wants to volunteer or who can provide assistance to folks, if we go to michigan.gov/fight COVID-19, that's michigan.gov/FIGHTCOVID19. That's how you can find out different ways to help your local communities or connect to offer assistance. And also, if anybody is having trouble with that, please feel free to reach out to my office, and I'll give you 517-373-7515. 517-373-7515. And again, Katie, thank you.
Can I say something too? This is Jim Ananich. That's okay. Go ahead. I've been in elective office for a little while now, and CNS Motors has done tremendous work for years. So I want to thank Katie for that. They've provided a number of vehicles for the city of Flint, tremendous company, and you can also, Representative Cherry, I think, did a great job of giving the resource where specifically where you can get the more information about it, and obviously you can call his office or mine as well to connect you either here in Genesee County with the Emergency Operations Center. Each county has an Emergency Operations Center as well, and they may be able to help get you some ability to help as well. And then we're seeing folks all across the state helping in many different ways, whether they're making machines to clean masks and other PPE equipment. We're seeing Michigan Tech has come up with a large-scale machine that's going to be able to clean thousands of masks at one time. We'll get in contact with you because there's a lot of folks that really want to be helpful right now in these trying times. And that's it's really one of the bright lights we've seen is just the decency of people. So thank you, Katie, and thank you for your family for all you guys have always done.
Thank you, folks. This is your last call. If you have a question, please press 0 on your keypad. Press 0 on your keypad, and we'll keep going through as many questions as we can. This question is for you, Senator Ananich. This comes from Anita. Anita, can you tell us where you're calling from, and what is your question, please?
Hello.
Hi, Anita. Go ahead with your question, please.
This is Amita, and how are you, and thank you. I have a question here. I'm very proud of our governor and all those that are helping, but I have a problem with my census. I have mailed it in, and they have called. I have received a call that they haven't received it, and so my cell phone is not working because I can't get out. I'm 89. How will I get the census? Because they say they can't mail it out.
This is I appreciate the call and the important topic, and I will say just to everyone listening, it's an extremely important time to fill out the census now, and if you can do it online, which many people can, you can do it very quickly there. Obviously, Amita, that's a different situation for you. If we can find, if you could, I'm not sure if you can write this down, but my number is 517-373-0142. Also, if there's a way for someone on the line to get her information offline, we can call her as well, because we want to make sure that you said someone called you to tell you that they didn't get it. We want to make sure, because in one of the terrible things we've seen during this crisis, aside from the health, is that there are people that are trying to take advantage of people because they know they're home. And we want to make sure, I'm not suggesting that it is, but we want to make sure that there was no scam where someone's trying to get information out of you, and that we can try to find out whether or not the materials that you sent in got there. There's a chance that they did, and you were counted like everyone else that we want everyone else to be, and that somebody is playing some sort of game, and we want to make sure that's not the case. So you can call my office. You can also call Congressman Kilday's office here in Flint. But if we can get your information offline, we will also try to see if we can solve this as quickly as we can, because we want to make sure you get counted, but we also don't want to make sure somebody is trying to fish for information, because that's, like I said before, some of the troubling things right now is there are folks that are taking advantage of this crisis and trying to come up with scams, and we want to make sure people have full information about how to not let that happen. So thank you for that, and hopefully we can get that resolved for you as quickly as possible.
Thank you very much. Good warning, Senator. We will take our next question. This is for Kirk Smith with the Greater Flint Health Coalition. Terry, please tell us what your question is and tell us where you're calling from.
Hi, this is Terry Cross. I'm here in Davison, and I have a question about the availability and the reliability of testing here in the county. And also, have we detected and identified virus hotspots in Genesee County? How did we get such high numbers here? Thank you.
Hi, Terry. Kirk Smith from the Greater Flint Health Coalition. And starting with the first part of the question about testing availability, thanks to Governor Whitmer, there was an announcement earlier this week about an expansion of drive-through testing sites throughout the state of Michigan. Obviously, testing has been a challenge up to this point, and the state has worked incredibly hard to make sure that more testing was available at more sites. A reminder is the first step for anybody who has symptoms and wants to know if they should get a test is to consult your healthcare provider, your primary care physician, to be pre-screened. The announcement this week that will expand testing, ideally consulted with your healthcare provider, is an expansion of a new drive-through testing site, the first one that we've had in Genesee County, that will be operated by Hurley Medical Center for patients that meet the state testing criteria, and that site will be located at Atwood Stadium on University Avenue in Flint. Now, in order to utilize that site, patients must call ahead to get an appointment and complete a pre-screening, and the hotline for that actually opened today at noon. The number for that hotline is 810-262-3685. The second part of your question, I would refer you to an online resource, was related to, are there hotspots in Genesee County? Are we seeing increases depending on different parts of the community? At the Genesee County Health Department website, gchd.us, there is a daily dashboard that not only shows you the number of cases in the county, but the breakdown by zip code in terms of what's being seen across the community. So we believe over the course of the next week or so as this new testing site launches, and that site will be conducting tests every Monday, Wednesday, and Friday for those with an appointment. That expansion of testing will help us to make sure that those who need a test can get a test, especially those that really are targeted within that state priority testing criteria.
Thank you very much. We have our next question for Steve Gray, who's the director of the Unemployment Agency. And this is Gloria. Gloria, can you please tell us your question and where you're calling from?
My question is, are unemployment provisions being made for people who are under employed wages?
Thanks, Gloria. That's a good question. So there's two sort of areas that we're making provisions for people that are underemployed or underemployed wages. So if you have been working for a while and been working part-time, or you had your hours reduced, you could be eligible just for regular state unemployment benefits, but just at a reduced rate. And if you qualify based on your work history, then you're going to get the unemployment benefits plus the $600 federal payment that came as a result of the CARES Act. So we call that underemployment, and that's existed and still continuing to exist. Now, the other group of people are people that have been working part-time, but they don't have enough wages to cover or to qualify for regular unemployment. And as a result of our congressional delegation here in Michigan, they passed the CARES Act, and that CARES Act provided what's called pandemic unemployment assistance, and it's to cover people like the self-employed, the 1099 people, or the people with limited wages that wouldn't qualify for normal state unemployment. They can get basically the same amount of unemployment benefits plus the $600. And we posted an application for that. You go to the michigan.gov/UIA, and you're able to apply for either of those types of benefits there on the website.
Thank you very much. This next question is for Representative Cherry. This is Hawita. I hope I'm saying that correctly. Go ahead with your question, and please tell us where you're calling from.
This is Hawita. I'm calling from Flint, but I asked my question earlier. It was about.
Can you go ahead and repeat it for us?
Pardon me?
Go ahead and repeat it for us. Please go ahead and repeat it for us.
Okay, my question was this. My son works at a warehouse where they supply food for stores, and it's essential, but he has asthma, and he really is concerned about having to keep going to work with his asthma. He may end up with the virus, but if he take off of work, he won't get paid, and he cannot get unemployment. So I was wondering if you could get unemployment if you feel like your health is at risk.
Hawita, this is John Cherry. Thank you very much for your question. Now, with the governor's executive order, and first I want to say thank you very much for your son for doing this essential work. And as a former employee when I was in college at Meyer, I know folks there work hard, and we're seeing just how essential some of the folks who maybe don't get paid as much as they should are in our society, and we need to reassess some things. But in relation to your son, based on action the governor taken, no one can be fired for being a high-risk person and taking off work. And I believe that he also should be able to claim unemployment, but I'm going to leave that to Mr. Gray just to confirm that folks in that situation. And then also, being threatened to be fired, any violation like that, they should report to local law enforcement. And so I'd like to turn over to Steve Gray on the unemployment piece of that.
Sure. Thank you. Thank you, Representative Terry. So you're absolutely right. If you're off work or if you're currently temporarily unemployed as a direct result of COVID, then you'd be eligible for either regular state unemployment benefits or the pandemic unemployment assistance. And you apply for both of those at michigan.gov/UIA.
Thank you very much. Up next is a question for Senator Ananich. This comes from Sandra, and she asked that her question be read. Her question is, thank you for your fantastic job, Governor, and I would like to know about high school seniors. Will they graduate? Senator.
Extremely important question, and yes. So if you're a senior right now, assuming you were not in a troublesome situation when the school year ended, you will graduate and finish up and be able to move on to the next level, whether that's community college, university, or want to get a job. Same is the case with K through 11. If those individuals, students, were not in a bad spot if they were on pace to move to the next level, they will move on to the next level as well.
Thank you very much. Our next question comes from Carol, and this is for Dr. Lawrence Reynolds, who's the health advisor to Mayor Neely. And I'm going to just read Carol's question. And Carol's question is, why is there a hospital rule that you cannot have surgery unless it's an emergency operation? My daughter had to suffer for 2 days with her doctors trying to get her into surgery, and the hospital was not overwhelmed. Doctor, can you respond to that, please?
Yes. I can't speak for the hospitals, and I understand your concern. But what I can say is there's a shortage of masks, gloves, and intensive care, so that should they do an elective surgery, usually things go fine. But you have to have backup in case things don't work according to plan. And those things like ventilators, ICU beds, or a regular hospital bed at a time like this is a problem. So it's to make sure that equipment is for people who have life-threatening conditions. And I'm sorry that your daughter had to suffer, and I hope she's doing better now.
Thank you very much. And we have one more question we're going to try and get in here. This is Tim, and this is a question for Kirk Smith with the Greater Flint Health Coalition. Tim, can you tell us where you're calling from? And please go ahead with your question.
Hello. Hello.
Hi, Tim. Go ahead with your question.
And it's Kim. And my question was, how are we going to know that it is truly safe to return to our jobs? I've already been given a date of April 30th of returning, and how will we know, will it be safe? And also, this is a second question, how come so many of the essential businesses are not providing gloves and masks for their employees?
Hi, this is Kirk Smith, and I think this is a question that everybody's asking. I think in terms of the April 30th date your employer is giving you, I would guess that date is in alignment with the Stay Home, Stay Safe order that Governor Whitmer has provided. That really makes sure that non-essential services are keeping people at home if they can work remotely to do that. We don't have an exact number. The goal is really about that flattening the curve and doing the things that we're talking about every day relative to staying at home, social distancing. When we see that curve start to flatten, when we see cases go down and level out, it'll be that point that I think it's safe for individuals to return to work, and that's where we're lucky to have the folks like Governor Whitmer and Senator Ananich and Representative Cherry to make those calls for us with the Michigan Department of Health and Human Services in the weeks ahead.
Thank you very much. And folks, we are at our allotted time for this evening, and we thank you for participating. I just want to let you know that as soon as the call ends here in just another minute or two, then you can leave a voicemail at the end of this call. If you have a question that wasn't answered, or you do have another question, or you need to get in touch with your lawmakers, you can just leave a voicemail at the end of this call here, just coming up in a minute. So just stay on for another minute, and we will turn it over to our two lawmakers for a close, and then to Tom from the Michigan State Innovation Exchange. First, we'll go with Representative Cherry, and then Senator Ananich. And if you wouldn't mind leaving your giving your phone numbers as well, so folks have that in your close. Representative Cherry.
Thank you very much. And I want to say thank you to all the panelists who participated and answered folks' questions today. Everybody who called in to ask questions. I'm sorry, we're not able to get to everybody, but if there's questions that you want to reach out to my office, if you don't leave a voicemail, my phone number is, again, 517-373-7515, or you can email my office at johncherry, JOHNCHERRY, @house.mi.gov, johncherry@house.mi.gov. And I just want to, again, thank everybody here and the governor and Senator Ananich for this, in Six as well, for putting on this town hall.
Thank you. This is Jim Ananich, and I want to give you my phone number first, 517-373-0142, or you can also email me at sen, SENJANANICH, so sen, my first initial last name, at senate.michigan.gov. if you have any questions or concerns, if we can help you with anything. And I want to thank everyone who participated, Representative Cherry, Dr. Reynolds, Kirk, Ivan for moderating, Tom from SIX, Steve from the Unemployment Agency, welcome virtually back home, and to of course the governor for all the tremendous work she's been doing, and to all of you that were on the call, and obviously for all the Michiganders that weren't able to be on here. I want to first say that there's a lot of hope, and we're going to be okay. I think that's important to note. We're going to come out of this, and we're going to come out of it stronger. This is a real tough time, but Michigan is full of tough people. If we all do our part and remember and think about others and stay home and stay in place, the longer we do that, the flatter the curve, meaning that the COVID virus will go farther and farther away, and will be less and less likely to infect people, then we can all safely go back to some resemblance of normalcy. And as the governor said, it may take some time to get back to where we used to be. But I think if we remember all the positive things that are happening, the amazing people doing amazing things, as little as just calling a neighbor to donating thousands of masks, which we've seen, there's a lot of hope out there. And if you're stressed, if you're feeling like that you don't have hope, check in on your neighbor. And if you're feeling good, then you should check on your own neighbor to make sure they're doing okay, because we're always stronger together, and fear is not going to beat us. So thank you, everyone, for being a part of it. Thank you for all the questions and comments. Every person that spoke today brought up something important and really relevant to what we're dealing with right now, and I really appreciate it. It'll definitely help inform my decisions going forward. Thank you.